Hello again, and like I said, we are finishing up the Endocrine series. So we're doing double duty today, trying to play catch up. All right. So today we're going to be talking about ADH. Wow, there is a lot to talk about with ADH. This is so testable, man. Okay. So antidiuretic hormone, and what are we doing at RN Cliff Notes? Helping students to see through larger concepts. All right, by doing what? Giving you study smart strategies. Yes, you're in the right place. All right, so we're numbering our paper or our device from 1 to 10. You know how we do. Yes. All right, number 1, right out the gate. What kind of trauma could lead to your client being in danger as a result of changes in their ADH secretion? What kind of trauma? All right. And one of the first things that should come to your mind is head trauma. Head trauma. That's right. And here's where we start threading in the concept of ICP, increasing intracranial pressure. Really important. All right. Now, what specific structure could be damaged as a result of that trauma? And you should say, well, not just say, isn't that right? Writing it down? You better be. Okay. Yeah. Pituitary gland. Absolutely. The pituitary gland. But I'm not done with it yet. Right? Because we want to learn it all. There it is. Where is that thing at? Where's the pituitary gland? Which one of the structures? And you should have picked number 7. Okay, let's backtrack because there might be some people who skip videos and jump straight to this one. Shame on you. All right, yeah. Okay, so here we go. You don't want to forget that towards the back, when we're talking about these structures in the endocrine system and things like that, towards the posterior aspect of the head and the brain there, we're looking at the pineal gland. So number 1 was pointing to that right there. Number 2 was pointing right here. And that is the structure that's holding the pituitary. So let's see, what will make a good pituitary for us? All right, well, it's going to have to be this bottle of water here. Okay, so 2, my hand. And if you take a really close look, right, in your book or something like that online, it almost looks like the hypothalamus. Looks a lot like a bird beak, right? The beak of a bird. Yeah, just flow with me. It might take a couple looks at that thing, but eventually you start to see it like, oh, wait a minute, yeah, I see it, right? So you see it like a bird's head, and the beak looks like it's got a little bug in its beak, right? And that little bug hanging from the beak there, right? That's the pituitary. Okay? Yeah. And that's what number 7 was pointing at. What's hanging from the little bird's beak inside of the side view of the structures of the brain. Let's set this to the side. Okay. So pituitary. Good. All right, now 4. What is the abbreviation of the hormone that regulates the excretion of water from the kidneys? And you guessed it. That's right. But we want to break that down too while we're getting at it. ADH. So we said antidiuretic hormone. Okay. Anti, we know working against. But diuresis, just one of our medical fancy terms for, right? What? The release of urine. So this is going to oppose or work against the release of urine. That is important to take in, right? What you don't want to do is go through this material and you're taking exams and, oh, it's ADH and just kind of memorizing around it. That is no good. Antidiuretic hormone, stopping the outflow of urine, okay? Good. Now, you know how I like to do this. This is the way, you stack these up like this and you start to see what endocrine's all about. All right, so we want to take it to a high, right? So we got a lot of secretion going on, and we wonder to ourselves, what condition would our patient wind up with? And then under secretion of that, and what condition does our patient wind up with, right? And that teaches you a lot. Here we go. So, number 5, what condition can your patient be diagnosed with if they have, right, high or excessive levels of ADH? And on your paper or your device, you should have the following. You should have SIADH. SIADH. All right? SIADH stands for the syndrome, and we've been talking about that, right? The syndrome, right? Multiple things happening at once, of inappropriate antidiuretic hormone, SIADH. So, in this syndrome, the ADH level is inappropriately high. Okay? All right, good. Now, next, 6. What condition can your patient be diagnosed with if they have insufficient, right, levels of ADH, or their ADH is undersecreted? Then that would be diabetes insipidus. Hold it. People hear diabetes and, start making the wrong connections. The only thing shared between these diabetes, right, is it's not diabetes mellitus. We're going to get to that in another session with endocrine. But this is diabetes insipidus. But they both tend to suffer from polyuria. You're going to need to hang on to that hint for the rest of the quiz. They both tend to suffer from polyuria. So both types of diabetes, polyuria and potentially polydipsia, right? Thirst. Okay. All right, so as we build out our chart, we got our SIADH, right? Too much ADH. We got our diabetes insipidus, not enough. And we just said it. What? These folks are what? Polyuria, letting out a lot. Why? They don't have enough antidiuretic hormone. Absolutely. These people got too much antidiuretic hormone, so you're seeing oliguria in them, or anuria, right? Oliguria, just a little bit. Anuria, practically none, right? In terms of urinary output. Good, good. Okie dokie. So 7 and 8. Now we're getting to some pay dirt, okay? But this is relative to SIADH now. So 7, what we want to know, we want you to identify the osmolality, love that word, of blood as, but we're keeping it simple. So the blood, is it going to be dilute or is it going to be concentrated? And then here, hopefully you can see that yellowish orange. I went for orange, you know what I mean, so you can see it. So we want you to identify the osmolality of the urine in the same way. Will the urine be dilute or concentrated? Now remember, this is relative to SIADH this time, okay? So you put those down for 7 and 8. Dilute or concentrated, pick one, right? All right, now same thing for 9 and 10. But 9 and 10 this time is relative to DI, diabetes insipidus. So this time, right, if they have diabetes insipidus, will the blood be dilute or concentrated? All right, and also with diabetes insipidus, will the urine be dilute or concentrated? So take your pick, and you should have the following, right? With SIADH, too much ADH, what's that person doing? Holding on to all their fluid in the bloodstream, resulting in diluted blood, watered down blood. Now think about that, that's dangerous, right? In terms of blood pressure and electrolyte balance, absolutely. Then now, their urine is going to be super concentrated. So the little bit that they let out, those little drops or whatever, they're going to be highly, highly concentrated because most of the water is back in the person's blood, okay? Now, on the other side, the opposite is true, diabetes insipidus, which we said, what, polyuria here? So these folks, right, their blood's going to be really concentrated and thick because it's missing the water. The water is actually flushing out of their urine so fast that the urine's practically going to look like water, right? And as a matter of fact, one of the things that sometimes they'll do with a patient like that is have them undergo the water deprivation test. With the water deprivation test, for about 4 hours, not going to give them anything to drink. But you're going to watch them run to the bathroom like they've been chugging fluids the whole time, right? Which is super dangerous, that they're just going to let all of their fluids out until they have practically nothing left. And you can imagine the chaos that ensues in terms of their electrolyte balance, right? Okay, so anyway, yeah. So their urine, way diluted, okay? Watered down tremendously. Okay, hey, thank you guys for liking and subscribing, okay? And stay tuned. All right.